Good morning all, and happy school year 2019-2020, and all the new beginnings that it is sure to bring. My name is Lois Mulhern, RN, and I am the School Health Manager for the Waterbury School District. Joining me today is Dr. Vernon Ruffin, who is our Waterbury School District Superintendent of Schools. Dr. Ruffin, I can't believe it's a year since we had our first talk and welcomed you to the Waterbury School District.
I remember, it was as if it was yesterday.
I mean, it's just flown by.
It has flown by.
Flown by.
It's been a good year.
It's been a good year for you?
Yes.
Great, because Waterbury is surely happy to have you.
Thank you.
So the past school year brought us together to collaborate around several topics which are related to school health. We moved forward in our quest to better serve the thousands of children in our city who have asthma. We set a goal last year that all of the children who require medication during the school day would have an asthma action plan on file in the nurse's office. Congratulations to parents, school nurses, educators, and providers as we achieved our goal. 100% or all of the children with asthma who need medication while in school had plans on file.
I think that's amazing.
Isn't it?
It is.
To go from 10% to 100% in one school year. And it's because of the collaboration between all of us. So everybody, keep up the good work and make sure that your children's asthma action plans are turned into the school nurse's office in the beginning of the school year, because it is a yearly requirement. Another great thing that happened this year in our school district is that the education department organized an asthma camp for the children, a pilot camp for the children, which was held at Drake's.
Yes. I had the opportunity to attend for a short period of time and was able to see the children interacting and learning about their own care, and it was very amazing. I didn't realize that there were so many opportunities for students to self-regulate and that they were taking ownership of that. And I do appreciate the team from the Waterbury Public School side, and certainly with the health department, the nurses that came out to be able to help and to facilitate and to partner. They were amazing with the students. It was a pretty amazing opportunity just to know that our students are in better hands and that they're able to help themselves as well.
That's right. I mean, self-responsibility, self-advocacy, and in the end, our goal as in school health is that as students move along the age continuum, that they can rely on themselves when they have chronic illnesses. I was there, and I have to tell you, I was so impressed with our kids. I went around from table to table. They had 3 education tables about the disease process. They were blowing up balloons, to see what their tidal volume was. And we had respiratory therapy students from Naugatuck Valley Community College and nursing students from Naugatuck Valley Community College. And I was quizzing the kids, I watched them and they were so intent. And then I was asking them questions, and I'm telling you, these were kids that were, K through 4, they mastered it. They knew all the answers. So it was just really remarkable.
It was.
So this year, we are taking our care of children with asthma, which is a critical issue here in Waterbury, which affects over 4,700 children, a step further. The health department is providing our school nurses with stock levoalbuterol, which is an emergency medication, so that our school nurses will be able to give emergency treatment to students who, for whatever reason, students with an asthma action plan and an order for medication, but many of them self-carry, and some days we forget our inhaler.
Sure.
So if a child presents to us in respiratory distress, has asthma and an order, we will now be able to give them that treatment emergently if they don't have their inhaler.
Well, that's awesome.
Yeah. it's so important with asthma. Every moment counts when a child presents to you in respiratory distress.
Yes.
So we have it right there, we can do that. So that's a big, in school health, it's a big step forward.
Yeah, we really appreciate that.
Another new initiative on the horizon this year is a welcome center that has been created to accommodate students new to the school district. Did you want to speak about that, Dr. Rowe?
I'm quite excited about the Welcome Center. The Welcome Center replaces the previous concept of an intake center and a family engagement center, and it really combines them to really be a one-stop shop for our students and our families. As we know that when students register to attend school for the first time in Waterbury, they go through one particular building. Previously, they had to go to multiple, but we have consolidated the concept of a welcome center to be in one location. In that location, we not only have those that will assist in registration, but the health department is there. We will have transportation included. We will have certain testing that will be available. We will have information about the city of Waterbury, because many of our registrants are brand new to the city of Waterbury. Some are new to Connecticut. And we want people to truly feel welcome and to know where to find things, how to be able to navigate what could be a very complex system. And so we're really pleased that the concept of the Welcome Center will be coming into fruition at the beginning of this school year.
That's wonderful. What a great idea. I mean, it just makes sense. And for the families, you know, and especially if you're new, you know, to have to be going around to all these different places.
It's complicated, and we wanted it to be an easy access. We wanted to assure that the students received everything that they needed, including their school assignment, transportation if they needed it. If there was specialized testing, we wanted to be able to take care of that in one location. We didn't want to make it a navigation issue for our families. It's difficult to navigate a new city and all of the processes involved. We also wanted them to be aware of the immunization. We wanted them to take care of it early, and we wanted it as easy as possible. And we wanted to provide it in multiple languages.
Yes, and as a matter of fact, I'm glad you mentioned about the immunizations and of course the physicals too, because we worked together this summer to create a list of all the places in the city of Waterbury and insurance and who takes insurance, who doesn't, and so that the parents have more than one option to go around to get physicals and immunizations done. So we did do that, and we've given it to the Welcome Center to utilize. So, well, and last but not least, the coordination of school nurses, principals, the school children's immunization clinic at the health department, and district administrators has reduced the numbers of children who were not in compliance with their physical exams and immunizations substantially. So we need to keep up that good work. Parents, we need you to continue to get your children immunized and to get the children's physical exams done for entry for pre-K, K, 6, and 10.
We're delivering that message again. We want to make certain that it takes on a priority. It helps so much when families can take care of that before school starts. It eliminates a lot of stress, and we have a lot of places that through the provisions that you have given to the center, I believe that it becomes less cumbersome to schedule an appointment and to take care of all of the shots that students will need before school starts.
So, community at large, parents, children, students, educators, and community members who are interested in our students' well-being, keep up the great work. And Dr. Bruffin, thank you for your time, attention.
It's been a pleasure.
And cooperation in matters concerning our children's health, and we continue to serve them together.
Thank you. We're going to have a great year.
Yes.